We're back from Eddie's. All right, 5 minutes have expired. You are set up. If you may identify yourselves, and you have 15 minutes.
Thank you, Mr. Chairman. Thank you, council members. My name is Bill Kissel. I am the Regional Vice President for Correct Care Solutions. And on behalf of Correct Care Solutions, we are grateful for the privilege to compete to be your partner in the delivery of health care at the Volusia facility. First, I'd like to say that on behalf of our president, Patrick Kaminsky, who recently had surgery, he wished he could be here. He would rather be no place else, but he was grounded, and his doc says no flying. So he sends his regrets, but he's here in spirit.
Hi, I'm Kim Christie. I'm a registered nurse, 26 years in corrections, and I am a transition coordinator for CCS, also a certified correctional health professional with the NCCHC, as all three of us are. I'm a certified corrections nurse manager for the ACA.
And my name is Gina Rose. I'm the Director of Client Partnerships for CCS, which means that I will be responsible for making sure that, if we're fortunate enough to work with you all, that we follow what we said that we were going to do and follow through on that. I'm also a New Smyrna Beach High School graduate, class of 96, so it's an honor and a privilege to be here.
And again, I will be the person here for startup. I will also be a constant and consistent person at the facilities to ensure operations and delivery of services. First, we'd just like to give you a brief overview of who we are, what our mission is, and what is our culture. What is our culture as a correctional healthcare company? First of all, we want to be the company that solid, valued correctional healthcare professionals want to work for. We also want to be the company that clients want to partner with in the delivery of correctional healthcare. We also want to be a partner with the community. We want to be part of the solution of the issue of the incarceration of persons with serious and persistent mental illness and other issues. We want to be part of the solution here in Volusia. And we also want you to know that we operate with a culture that we want every patient treated how we would want a family member treated if one of our family members was incarcerated. Very few families go unscathed, and mine own included. And we focus on making sure that patients are treated with respect and as we would want our family members treated. At a glance, we are in 38 states. Here specifically in Florida, we operate 3 jails right now. We have 4 psychiatric hospitals, 10 juvenile facilities, 1 Volusia, which we started just yesterday. We took over yesterday, and I will be going there right after this presentation. So we have a strong presence in the great state of Florida, and look forward to providing more services here in Volusia. We have experience transitioning other facilities from your current vendor. We have transitioned over 31 facilities from your current provider successfully. We are proud of our history of, during those transitions, improving clinical outcomes, reducing litigation, and reducing grievances. Additionally, we want to, as I said earlier, we want to be a partner in Volusia County, and we want to be a part of the solution of issues. I personally am an advocate for persons with serious mental illness. I live in Georgia, past president of the National Alliance of Mental Illness Georgia chapter. I want to applaud the council for their decision to move towards partnering with Stuart Marchman years ago. I think it's the right thing to do. We have met with Stuart Marchman multiple times. Of course, you saw in our proposal, we plan to partner with him in the delivery of behavioral health services. We know it's the right thing to do. It is a model that we ourselves have done proactively in other facilities. Excuse me, for example, in our Davidson, Nashville facility, we did it, we partnered with a local community health provider in 2006. It's been very successful. It's improved continuity of care, discharge planning, reentry, and we're proud of that. And again, we want to applaud that the council has been so progressive because of the issue of the incarceration of persons with serious and persistent mental illness.
And going back to community connectivity for a moment, I just want to also highlight that community connectivity and partnerships is part of the core of what CCS is all about. We have reached out to the Halifax Medical Center prior to this point in time because we know the importance of starting a dialogue with these local providers so that we can ensure once the contract is awarded that we are prepared to negotiate the best possible rates on the part of our clients. And I think that we started that process going in our discussions with them.
Okay, hold 1 second. Freeze time, please. Can we fix the screen here? We're not jumping. It just kind of, I have a problem, it says. Are we all better now? Okay, I'm sorry. I'm sorry for slowing you down, but your screen was not changing. All right.
Glad we didn't do anything wrong.
No.
I'm still not clicking through.
Okay, grabbing.
Oh, it's not.
Okay, we're back on. Okay, sorry for slowing you down.
And as a partner, it's our responsibility to find cost efficiencies and save the county money wherever we possibly can. Reaching out to your current dialysis provider to find out if there may be efficiencies there to the services that are provided on the site. Always analyzing statistical data for off-site transportations and trips. And we didn't have a lot of statistical data in the preparation of our proposal, but we do have national contracts with providers who are willing, ready, and able to come on-site to provide services. Institutional eye care is a perfect example. They've given us a letter of intent to establish on-site optometry clinics. And our newly established Cigna relationship should also ensure access to additional provider networks and specialty physicians in the area. And after we focused on the client and community partnerships, we can begin to focus on our processes, which is how we ensure that we're providing quality care services to our patient population. Processes provide clinical consistency and are a big part of how we feel we differentiate ourselves from our competitors. We have nursing protocols. A lot of companies do use nursing protocols, but we call ours pathways. They provide consistency in care. We take a management by wandering around approach to the supervision of our staff and the supervision of our program. Bill is someone that you'll see regularly walking the streets and the halls of Volusia County and the detention facilities, making sure that we're doing what we said we do. We have an unparalleled patient care management system called Irma Care Management and appointment scheduling as well that has processes to ensure necessary services are provided and most importantly to ensure that no patient with special needs falls through the cracks in our institutions. This system also ensures that the community of providers are aware of third-party payment options so that you're not inadvertently or we're not inadvertently billed for payments that shouldn't be made. We use our quality improvement data and information as we strive to continually improve our programs and the care provided to our patients. We want to bring issues to you before you bring them to us. That's our goal. Our proactive mental health programs we talked about, and also our extensive reporting capabilities. We tailor reports for our clients that give you the information you need to ensure that you're getting quality healthcare services in the most cost-effective manner possible. So we believe in full transparency and accountability as it comes to all reporting.
I'm going to jump in there just to again kind of discuss a little bit about how these aren't just words that we say, but it's what we do, and we want to give you a little demonstration of that. We practice what we call exception reporting through our technology, and that is making sure, as Kim said, people aren't slipping through the cracks. So here's an example of a report where we have a standard time frame that we want to make sure that intake screenings are done in when someone is brought into a facility. And we want to then look at, not necessarily the times when all of that was completed perfectly, but where are the exceptions falling? Is there a certain shift where things aren't happening, and is there a staff member there who needs additional training? Are we finding that during certain hours our staff can't keep up with the intakes? Do we need to staff additionally there? And so with this type of reporting, we're able to actually get in, drill down on those exceptions, and make sure that we are taking care of our patients in an appropriate manner. I respect so much the fact that you guys look at this as an extension of your public health system, and that's how we look at it too. So making sure that we're not letting those people fall through is essential to us. We don't want to just avert negative press or litigation. We want to avert negative events at all. And that gives us a little bit of a segue rather, into our technology differentiation. We have our internally developed electronic records management application. That application was developed by physicians and staff members that we have who looked specifically at corrections and said, what do we need in order to make this work within our correctional workflow? It's operational throughout the country, but notably in Pasco County, as well as in other areas where we have the mental health model, like Bill mentioned, in Nashville, Tennessee, Durham, North Carolina. We work with the health department. So in all of those places, we have this system operational. Our clients can have read-only access, so they can have that full transparency that Kim talked about. And we use this to drive our CQI studies so we can say, how do we do better? Let's not stand on the status quo, but how do we drive ourselves to a better operation daily? And one place that we want to point out, I thought it was important that you not just hear from us, but hear from one of our clients in Macomb County, Michigan, which is just outside of Detroit. It's a 1,400-bed facility. And the jail administrator there gave us a compliment on our operations there, on the processes that we put in place, which she said, you can see at the end there, safeguards are in place to prevent those negative outcomes. That is our goal.
Thank you, Gina. And the electronic medical record, IRMA, will be installed within 90 days of start. It will be operational, staff will be trained, and it will be used to improve patient care and operations. We talked about our processes, we talked about our technology, all great things, but would not be of any value without good people. Our number one resource is people. It has to be our healthcare professionals. We are committed to our folks. We provide leadership training. We provide online training. We provide support on site. We provide opportunities to attend conferences, National Commission on Correctional Healthcare, ACA. We are invested in the growth of our staff because we know that our staff are our number one resource, and that will be the key to success of quality patient care.
I think it's important to note that we empower them also and train them to train each other. We have a train the trainer program, and this is a picture from our Pasco County session that we actually did out there, where then they're able to take the education that they gain and spread that to their peers.
And we operate on a model, the right people doing the right thing the right way. I'm proud of a recent success we've had. Yesterday marked our 1-year anniversary of starting at Pasco County, Florida. I was part of that startup. It is in my region. I'm there on a monthly basis, and I'm proud to say that we have been 100% staffed continuously. We have improved patient outcomes. We have reduced off-site care and kept officers inside the perimeter of the facility, and have reduced grievances and litigation.
In the interest of time, I'm going to make this pretty brief, but we did want to make sure that as you all are looking at this, we feel it's our responsibility to approach you as partners and as an agency that has numerous contracts within this area, and say there were a couple of things that were unique to this process that could provide cost savings opportunities for you. And just as a top line item on it, it's the potential savings on the first two bullets over the life of the contract would be about $1.25 million, which I'm sure Volusia County could find use for. So the first is the insurance requirements. You guys had an umbrella requirement of $25 million, and our policy right now is for $5 million. We get great premiums because of our great policies and our operations, but that would still cost us an incremental cost of $200,000 per year. So that's cost that we have to pass on. So if you all wanted to take a look at that in a negotiation situation, we wanted to let you know that we would be open to that if we're so privileged. And the performance bond that you have in place also costs about, there's a cost to us for that. So again, we have to pass that on, and it's about $50,000 a year. So that's the other $250,000. That would be an opportunity for savings if we wanted to look at that. And the final bullet there is just kind of making sure that everybody's looking apples to apples. Your current contract, I know you had asked, ma'am, for the current contract costs while there was a break, and the current contract actually incorporates all psychotropic medications into your qualifying aggregate costs. the RFP that we had asked us to take on the responsibility for formulary psychotropic medications. So all of that risk has been absorbed by us within our costs for the contract and will not be included in that qualified aggregate cap. So we just wanted to make sure everybody was looking at that apples to apples, because that was a little different from what you have right now.
And can I just say right before Bill closed, that I think that one of the key things that differentiates us apart from our competitors, not only is the quality of care, but the fact that we like to think out of the box and provide solutions. We like to identify ways that we can return money to the county. We've given numerous examples of ways we've been able to do that for other counties in our proposal, so I encourage you to look those over in the process of selection.
In summary, Mr. Chairman and Council, we again thank you for the privilege to compete for your business. We want your business. We value your business. We do, again, have a strong Florida presence. We have a regional office in Boca Raton. We have a regional manager, Stephanie Peskowitz, who is in-state, a regional medical director, Dr. William Ruby, who lives in-state. We operate 3 jails, 4 private psychiatric hospitals. We value the privilege, and we thank you for letting us be here today.
Thank you.
And you just made it under the wire. Okay, thank you very much. We will be in kind of a recess.